first question that we had was a 23-year-old female patient presented with severe diffuse hair fall since last 1 month. She had an acute illness comprising of fever, body ache, thrombocytopenia 4 months back. What is the most likely diagnosis? What do you see in the image? In the image, we see that there is a diffuse thinning of hair over the scalp. Diffuse thinning of hair over the scalp is what the image tells us. Same thing we get to know in the text, that there is a severe diffuse hair loss. It is affecting the entire scalp. Since 1 month, there was history of an acute febrile illness 4 months back. So what do you get from the question here? From the question, you get that there is a gap of 3 months between the illness and the starting of the hair fall. Okay, so these are the things that we capture from the question. Now, I have told you, whenever you get a question on alopecia, the first thing that you have to do in the question is to identify what is the spread of the hair fall. Is it diffuse, that is all over the scalp, or it is patchy? You see small patches in the image, or the question mentions it is patchy alopecia. Lastly, is it patterned, affecting only specific areas, progressing only in a specific pattern? So when the question says it is diffuse hair fall, you have to think of the effluviums, where we can consider Anagen effluvium or Telogen effluvium. In the patchy alopecias, alopecia areata, trichotillomania, and tinea capitis should be on the top of your differentials. In pattern alopecia, the only one that comes here is androgenetic alopecia. Okay, so half our job is done when we look at this distribution. So what is our patient suffering from? Our patient is suffering from a diffuse alopecia, thinning of hair all over the scalp. So we have to choose between Anagen effluvium and Telogen effluvium. Now, come and see the options here. Androgenetic alopecia. This is patterned. This is a hair loss that progresses over years. It does not happen over 1 month. There is no relevance of any history of an acute febrile illness here. So this is out. Anagen effluvium, Telogen effluvium. Definitely we have to choose between these two. Alopecia totalis is a type of alopecia areata where the entire scalp hair is lost. So the entire scalp is clean and smooth. Okay, so that is anyway not the option here, not the option here. Now choose between Telogen effluvium and Anagen effluvium by looking at the clinical scenario. If the question is suffering from patient in the question is suffering from cancer chemotherapy, there is history of a treatment for cancer in the question, which leads to sudden diffuse hair fall affecting 80 to 85% of the scalp. Patient goes almost bald. This is Anagen effluvium. On the other hand, in Telogen effluvium, there will be history of some trigger followed by a gap of 3 to 4 months and then increase in hair fall, which affects about 1/3 of the hair. So what you see is thinning of the hair. You don't really see balding. So you don't see that the entire hair is gone. The hair has just thinned out. Now, what are the triggers that can cause telogen effluvium? A sudden severe illness. This illness could be dengue, it could be typhoid, it could be COVID, any severe illness. In our patient, fever, body ache, thrombocytopenia might be going in favor of dengue. Maybe the patient suffered from dengue 4 months back. So after this gap, she's now suffering from increased hair fall. So the answer to our question becomes telogen effluvium. Come back here. See, severe diffuse hair fall since 1 month, acute febrile illness 4 months back. So this gap is there. Whenever you see this gap, the duration, then you have to start thinking of telogen effluvium, making option B the correct answer here. Is this understood? Good. So even if the image is there, you look at the image, see the entire image is bald here, the scalp is bald, here there is just thinning. So even the image gives you a hint as to what the diagnosis